So my name is Serge Belangi. I'm a professor of computer science at the University of Copenhagen and the director of the Pioneer Center for AI. It is my pleasure to introduce our next speaker, Herbert Bay. He's the co-founder and CEO of Earkick, the first real-time data-driven mental health tracker that uses a multi-modal AI approach to make tracking your mental well-being as easy as tracking the weather. Before Earkick, Herbert co-founded 2 computer vision companies, built a team at Magic Leap in the field of digital healthcare, and the computer vision researchers among us will recognize he's the original author of the SURF algorithm that is used for computer vision and AR applications such as object recognition, image registration, classification, 3D reconstruction, and so on. So it's a pleasure to have you. Please welcome Herbert Bay.
Thanks for the intro. So I'm Herbert from Earkick, and we're basically currently in the midst of a mental health crisis. As you might know, 1 out of 5 adults suffer from mental illness, and it's even worse for younger generations. It's 1 out of 3. I mean, I have 2 children. How high are the odds of them or me having mental illness, or of you or your families? It costs society a lot of money currently, even more than cancer or respiratory diseases or diabetes. But governments and society don't spend as much money for mental illnesses as for the other illnesses. And one thing is that measurement is lacking. Current measuring mental health is still based on manual questionnaires, and it's very biased, and there is also a delay. You can imagine if this would be with the other illnesses the case, then someone asking you, what do you think? How much cancer did you have the last 2 weeks? It's unsupportable. We cannot work like this, and evidence-based health is not possible that way. So what we need is something more granular and in real-time measurement mental health, and that's what we're doing. There are already over 30,000 mental health companies out there, but none is like Earkick. We measure mental health not only with video, voice, and other biomarkers. We of course also ask users and to do self-assessments, clinical assessments, but we also track things such as heart rate, how many steps, medical intake, what activities they did. We sync with their calendar, we track menstrual cycle, everything that can influence mental health. We track location, weather, moon phases, and so on. And this to measure the user's mental health on a personal level, but also we can measure on a company level mental health. And what we did measure was also on a national level. So at the outbreak of the war in Ukraine, we could measure a significant increase of anxiety score in the US. So where do we stand today? We have developed a great app that has a high ranking, was pushed by Apple. It's currently downloadable on the App Store. So please go ahead, feel free to download it and give us 5-star ratings if you like it. Then we reached a product market fit very recently. We're gathering information and data from it about users. We just translated it in Ukrainian, by the way. Our vision is integration with wearables and tools of everyday life, and this in order to automatically measure and continuously measure mental health. And this enables then in-the-moment intervention. We also want to expand this to other illnesses such as Alzheimer's and Parkinson's. So if you like this journey and you want to be part of it, please feel free to contact me directly. So thank you so much.